Okay, today we're going to be talking about biotoxins, bioterrorism. The events of September 11th, 2001, otherwise known as 9/11, have had a great impact on our society. Bioterrorism is just one of the weapons that terrorists use against us. One type of agent that's classified as a biological agent but behaves more like a chemical agent is biotoxins. There are several different classifications of biotoxins. Bioterrorism can be classified into 3 different categories, depending on how easily they can be spread, severity of illnesses or death that they can cause. Category A is the most severe, whereas Category B is more in the middle, but does cause widespread panic. Category C is considered to be new diseases. Category A. These high-priority agents include organisms or toxins that pose the highest risk to the public and national security. They can be easily spread or transmitted from person to person. They result in high death rates. They have the potential for major public health impact. They might cause public panic and social disruption, and they require special action from us, public health, for preparedness. Category B. These agents are the second highest priority. They're moderately easy to spread. They result in moderate illness rates and low death rates. They require specific enhancements of the CDC's laboratory capacity and enhanced disease monitoring. Category C, those are new and emerging diseases that we're just now learning about. Category A. And Category A has some illnesses that some of you may have heard of: anthrax, botulism, other known as Botox, depending on how you use it, plague, smallpox, tularemia, viral hemorrhagic fevers such as Ebola, Marburg, Lassa, or Machupo fever. Category B. Some you may have heard of, some you may not have heard of. Brucellosis, epsilon toxin of Clostridium perfringens, food safety threats such as Salmonella, E. coli, Shigella, glanders, melioidosis, psittacosis, Q fever, ricin toxin, it's probably one of the ones you've heard of, staphylococcal enterotoxin B. Also, Category B has typhus fever, viral encephalitis such as Venezuelan equine encephalitis, Eastern equine encephalitis, Western equine encephalitis, water safety threats such as Cryptosporidium parvum and Vibrio cholera. Category C has, these are the highest priority agents, the third highest priority agents in the line. They could be engineered for mass spread in the future. They're easily available, they're easily produced and spread, they have potential for high morbidity and mortality rates and major health impact. Examples. Examples of Category A. Anthrax, something we've all heard of since 9/11. Anthrax is a serious infectious disease caused by gram-positive rod-shaped bacteria known as Bacillus anthracis. It can be found in soil and commonly affects domestic and wild animals around the world. People can get sick if they come into contact with infected animals or contaminated animal products. Anthrax has been used as a weapon around the world for nearly a century. In 2001, powdered spores were deliberately put into letters that were mailed in the U.S. to 22 people, including 12 were mailed in the U.S. 22 people, including 12 mail handlers, got anthrax, and 5 of these 22 people died. Anthrax spores are easily found in nature. They can be produced in a lab, and they can last a long time in the environment. Anthrax makes a good weapon because it can be released quietly. The microscopic spores can be put into water, food, powders, or sprays. The spores are so small you may not be able to see, taste, or smell them. And like I said, anthrax has been used as a weapon in the past. Some of the symptoms of anthrax, the symptoms depend on the type of infection and can take anywhere from one day or more than 2 months to appear. All types of anthrax have the potential, if untreated, to spread throughout the body and cause severe illness or even death. Cutaneous anthrax. Those may cause a group of small blisters or bumps that may itch on your skin. A painless ulcer with a black center, almost like a pimple, it appears after the small blisters or bumps. Most often appear on the face, neck, arms, or hands, and swelling can occur around the sore. Inhalation symptoms of anthrax include fever, chills, chest discomfort, shortness of breath, confusion or dizziness, cough, nausea, vomiting, or stomach pains, headache, sweats that are often drenching, extreme tiredness, body aches, and then gastrointestinal anthrax can cause fever and chills, swelling of the neck or neck glands, sore throat, painful swallowing, hoarseness, so you'll lose your voice, nausea, vomiting, especially bloody vomiting, diarrhea or bloody diarrhea, headache, flushing, red face, and red eyes, stomach pain, fainting, swelling of the abdomen. Injection anthrax includes fever and chills, a group of the small blisters that may itch appearing where the drug was injected, just like the cutaneous, swelling around the injection site, a painless skin sore with a black center that appears after the blisters or bumps, abscesses deep under the skin or in the muscle where the drug was injected. Keep in mind, the symptoms are similar to those of cutaneous anthrax, but injection anthrax can spread throughout the body faster and can be harder to recognize and treat. Skin and injection site infection associated with injection drug use are common and do not necessarily mean that the person has anthrax. So this can be confused with IV drug use. The sites look similar. Botulism. This can also be known as Botox for women that get the skin injections. Same site or same form of botulism, different use. There are 3 main types of botulism: foodborne, infant, and wound. Foodborne occurs when a person ingests preformed toxin that leads to illness within a few hours to a few days. It's a public health emergency because the contaminated food may still be available to other people besides the patient. Say if it was injected into food at a grocery store or at an assembly plant or at a restaurant. Infant botulism occurs in a small number of susceptible infants each year who harbor C. botulinum in their intestinal tract. And then wound botulism occurs when wounds are infected with the C. botulinum that secretes the toxin. Foodborne symptoms include the fact that they start within 6 hours to 10 days, usually around 12 to 36 hours, most common, after eating the food that contains the toxin. You may have double vision, blurred vision, drooping eyelids, slurred speech, difficulty speaking, dry mouth, muscle weakness that moves down the body, usually affecting the shoulders first. Paralysis of breathing muscles can also cause the patient to stop breathing and die, unless breathing assistance, mechanical ventilation, is provided. Botulism is not spread from one person to another. Foodborne botulism can occur in all age groups. Nobody is immune to it. A supply of antitoxin is maintained by the CDC. It's most effective in reducing the severity of symptoms if administered early in the course of the disease. Most patients eventually recover after weeks to months of supportive care. Pneumonic plague. It's commonly talked about in books and movies. It's a disease caused by Yersinia pestis, Y. pestis, a bacteria found in rodents and their fleas in many areas of the world. Y. pestis used in an aerosol attack could cause cases of the pneumonic form of the plague. Y. pestis occurs in nature and can be isolated and grown in quantity in the lab, although it requires advanced knowledge and technology. So it needs special equipment to be able to be grown. Y. pestis occurs in nature and can be isolated and grown in quantity in the lab. 1 to 6 days after becoming infected with the bacteria, people would develop pneumonic plague. Once infected, the bacteria can spread to others who have close contact with them. So it is spread person to person. Because of the delay between exposure and becoming sick, people could travel over large areas before becoming contagious and possibly infect others. Airports, airplanes, bus stations, cruises, all great places to infect other people because it's a large quantity of people in a small confined space. Pneumonic plague can be transmitted from person to person. It affects the lungs and is transmitted when a person breathes in the Y. pestis particles in the air. Signs and symptoms include fever, weakness, rapidly developing pneumonia, shortness of breath, cough, sometimes bloody or watery sputum, nausea, vomiting, and abdominal pain. Without early treatment, pneumonic plague usually leads to respiratory failure, shock, and rapid death. But the bad thing is, a lot of these symptoms are things that occur with other diseases or sicknesses. So it can be hard to diagnose without the lab work. Smallpox. Smallpox is a serious contagious disease and sometimes fatal. There is no treatment, and the only prevention is vaccination. The only thing is, we don't vaccinate for smallpox anymore. There are 2 clinical forms of smallpox. Variola major, which is the most severe and more common form, with a more extensive rash and higher fever, a death rate of about 30%. However, flat and hemorrhagic are usually fatal. Variola minor, which is less common and much less severe, with a death rate historically 1% or less. Variola major has 4 types: ordinary, modified, flat, and hemorrhagic. Ordinary is the most frequent type, accounting for 90% or more cases. Modified, which is mild and occurring in a previously vaccinated person. Flat smallpox are rare and very severe. Hemorrhagic smallpox are rare and very severe. So you most likely will not see these. Smallpox is caused by the variola virus that emerged in human populations thousands of years ago. It's been eliminated except for laboratory stockpiles. The last case of smallpox in the U.S. was in 1949. The last naturally occurring case in the world was in Somalia in 1977, before most people in EMS were even born that are coming in now. Humans are the only natural hosts of variola. Smallpox is not known to be transmitted by insects or animals.